Cerebral palsy is a condition which can affect a person's muscle movement. This is due to the damage of certain brain areas that can happen usually before birth. Cerebral palsy itself is not a learning disability. However, it is one of the main causes for children to have different learning disabilities. There are three main types. The first is spastic, and this involves muscle tightness. Second is dyskinetic, and this is when there are issues with muscle control. And the third is mixed, so this means it includes both features of spastic and dyskinetic. Some causes of cerebral palsy before birth include genetic issues and the lack of blood flow and oxygen. However, some causes after birth can include injuries, physical abuse, or infection around the brain. Symptoms of palsy can either affect the whole body or part of the body, and they usually appear during infancy years. One of the main symptoms include trouble with a person's movement. For example, this could be a lack of balance and muscle coordination, or maybe a person may struggle to walk. However, these can vary, so one person may struggle to walk, yet others may not. Other symptoms can include delays in speech development. Someone may have trouble eating, or there may be delays in growth, so a person would be smaller than expected. Although there is no cure, there are multiple specific treatments that are used to help those who are struggling with cerebral palsy. One treatment is the use of medications. These can treat seizures and many other different effects of cerebral palsy. The medications can vary since they depend on the symptoms and effects of cerebral palsy. Another treatment includes surgeries. These can help with muscle, joint, and spine problems. There are also a range of therapies that can help with cerebral palsy. For example, speech therapy will help those who have trouble communicating. Mental health therapy can also help those with cerebral palsy who may have experienced symptoms of depression and anxiety.
Cerebral palsy can have a huge impact on a child's experience while at school. Due to the effects of muscle tone and movement and their coordination, this may affect their development of the finer gross motor skills, which could then affect their ability to carry out daily movements and motions which they may use while they're at school. The effects to the fine motor skills would impact the child's ability to write. So, for example, they may struggle with the formation of writing letters on a page. This can also affect other activities such as using scissors to cut things. So it's important that as a teacher we're able to provide the correct adapted equipment so that they are able to join in and partake in the lesson, so that they aren't missing out on any education, but also so that they aren't feeling left out. 6 out of 10 children who have cerebral palsy may suffer with a speech, language or communication issue. This is due to the difficulty of muscle movements. This can range from struggling to pronounce certain sounds or pronouncing certain words, all the way to being unable to communicate at all. So it's important that we're able to provide the correct intervention to improve their quality of speech, or being able to find the best method of communication for the child, but staff as well, so that we can improve the level of communication and be able to meet everyone's needs. 1 out of 4 children with cerebral palsy may also have behavioural problems, as well as 45% of cerebral palsy children tend to also have learning difficulties. This can impact the child's concentration span, their vocabulary level, and their memory. So it's important we take this into consideration while planning, so that we can provide the intervention again, so that they're performing to their best abilities, or so we can find techniques and methods which work best for the child so that they are performing again to their best ability.
Every child is unique, and therefore there is no single solution to aiding learning for children with cerebral palsy. Since a child with CP won't be like any other child with the same condition, educators must first understand how the child's disability affects their ability to learn as an individual, and offer the necessary building blocks to create a healthy self-image and ensure learning can take place. Teachers, therapists, parents, and the child with CP should work together to create an educational plan. This may include setting up an individualized education program, or an IEP for short. Things like if they struggle with mathematics or require mobility aids are taken into account when creating an IEP, so it can be quite helpful. Even outside of this, however, these factors need to be considered in the day-to-day of the classroom. Allowing extra time for new concepts to be understood, keeping walkways clear for easy movement, and being aware that some CP children are self-conscious of uncontrollable movements, and so they may prefer to sit at the back. Being aware of these things is important. Some children with cerebral palsy may feel left out. To combat this feeling of isolation, teachers could explain to all their students the nature of their classmates' disability, removing the air of mystery to it. The more we educate each other on how to treat, include, and care for individuals with special needs, the more attitudes and mindsets will change. Having said all this, it should be iterated that every child is unique, and therefore no single solution will work for every single child.
What is equality? Equality means that everyone is treated fairly and has the same opportunities regardless of their differences. Diversity is about recognizing and celebrating differences, including race, gender, religion, disability, and sexual orientation. Inclusion means creating an environment where every individual feels valued and respected, and where everyone has a sense of belonging. Schools previously had a statutory duty which required them to take proactive steps to tackle disability discrimination and promote equality of opportunity for disabled pupils. Within the Equality Act, it provides vital information for teachers. We must ensure, no matter the needs of the child, we do not discriminate. If a child struggles with mobility, we must not single this child out during physical education or during playtimes. The child will feel if they are being discriminated. There are two types of discrimination, indirect and direct. Indirect occurs when a provision or practice is applied generally but has the effect of putting people with a particular characteristic at a disadvantage when compared to people without that characteristic. Direct occurs when one person treats another less favourably because of a protected characteristic than they treat or would treat other people. Today in schools, children with disabilities remain one of the main groups that are being widely excluded from quality education. We must ensure that we prevent this from happening by communicating effectively with other professionals to provide the best support for the child.